Hi, Nurse Sherry here, and today we're going to be going over how to clean and take care of a laceration. So the past medical history of our patient is a 24-year-old male who had a knife land on the bridge of his foot, which caused a deep laceration. And so we're going to teach you over this video is how to clean it, how to close it, how to put a dressing on it, and some care instructions, and also how to document that when you are done. All right, let's get started. Whether you're a CMA setting a patient's room up, a nurse setting a patient's room up for the doctor to perform this skill, or if you're setting it up to do for yourself, you want to have these items. You're going to need gauze. You're going to need some wrapping of however you're going to wrap, different types, some steri strips, some of the glue that we're going to use for the closure, and some wrapping. So here is a picture of the skin layers. We have the epidermis, the dermis, the fat layer, and the muscle. And that's just going to show you when I show this picture, which is what the wound looked like prior to the first cleaning of it. And so we do have a laceration that has gone down into the fat, and what is shown is the fascia. And I'm going to go ahead and remove the dressing first. And you want to do this a little portion at the time, and you always want to pick up the dressing against the, so it's away from the skin while you're removing the dressing. So I previously washed my hands, and then I applied up gloves. As you can see in the scissors there, it has a non-sharp edge. So I take the first dressing off. I'm going to leave this portion on because my most important thing first, right, is to clean the entire foot. So I apply the wound cleanser over every portion of the foot, getting the bottom of it, everything that I have around that foot. And then I'm going to take the gauze and I'm just going to properly clean that foot because he wouldn't be able to do that by himself as he is, when you have something like this with the closure I'm doing, your foot should be out of the water while you're being cleaned. So I clean the entire foot, underneath of it, the toes and everything like that before I remove the old dressing. Now I'm going to take off the old dressing, which I had applied steri strips to as well. As you can see, it was pretty open yesterday. And when I take these off here, you're going to see that it has already started coming back together with those edges. So removing the steri strips, and then as you can see, it will open a little bit back up, but it has done pretty well with just steri strips. Now I'm going to clean the wound. When you clean a wound, you should start with the actual wound first. I did change my gloves because I just took off all dirty, and now I'm going to do clean. So you want to make sure that you always have a couple set of gloves there with you. I wanted to let that wound cleanser stay there for a minute so it got in there and made sure that it got it pretty clean as well. So now I'm going to go ahead and grab some sponges and clean at the actual wound first, right? Then I'm going to clean around the wound. And I want to make sure I get all of that because that dressing was covering a portion of that overlay there. So now I'm just cleaning around it. I used a new piece of gauze for each time when I am going to be cleaning the wound. As you can see, it kind of opens up a little bit more, but I'm using glue this time to make sure. Just one more spray just to make sure, since I use the gauze, I just want to make sure I have a new clean piece of gauze to tap that off just at the end here before I do anything else. After this, I am going to go ahead and grab my bandage liquid lidocaine. And so I'll show you a picture of that. This is just something I got at Walgreens. They have all different types of glue. I like this because it had some lidocaine in it as well, because this is a very painful laceration that my patient has. The next thing I'm going to do is go ahead and measure the wound. And then I'm going to apply the glue. It's best to apply it a few times. So I apply it. You want to make sure that you're holding your edges tight together while you're doing this, but not overlapping each other. And I'm just going to give it a few seconds before I apply the second coat of it. And then continuing to hold those together. I'm going to give it a few minutes to just hold that together before I apply the steri strips. But once I do, then they'll connect together and both will do the work to close this wound. All right, so I went ahead and closed those up for a good amount of time. So now I'm going to go ahead and get my steri strips so that I can apply them. This one looks like it needs about 2 steri strips. As you can see, I have mild drainage there, but not much. At first, it did bleed a lot because it had gone through the epidermis and the dermis and into the subcutaneous layer. So opening up your steri strips, you just want to be careful. You only want to take off one piece, and that way you're not touching it. And then you use the bottom that has a half piece of paper still on it to make it tight to apply it to the other side of the wound. And these are just regular steri strips. Also bought those at Walgreens, but you can get them at any store as well. At a doctor's office, obviously, you're going to have all these of supplies. So again, I'm pitching the skin. I'm going to put half of the steri strip on one side, keeping that skinny portion to go over the actual laceration. And you pull pretty tight to make sure that it's going to stay and that it's going to stay tight, okay? And so I finished one. I'm going to go ahead and get my other one. If I had to do 3, I would have done the center one first. It just makes it so that portion, because that was the widest portion of the wound. So I'm getting my second steri strip ready, and we're going to go ahead and apply that one. The same way, pinching the skin together. I have taken off half of the dry bandage on the side, and then I'm going to take off the second as I tighten it up to get that placed properly. Now, as you can see, these are well approximated. The edges look great. They are touching, and this should heal pretty quickly. And you would want to keep it like this for 24 hours before you clean it again, because you want to give it time for the steri strips and the glue to work, and not keep opening up. Now, this guy works, and he walks a lot during work, so I'm adding a bandage on top of it. Also, it'll help with any exudate that I might have whenever I do remove it. I use this Optifoam. I love these. I use them for a lot of different types of wounds, but I just want that extra padding for him for when he is walking so that it's less irritating and less movement of the skin. Now, since I'm not worried about it covering the entire wound, I just want it to cover, or the entire gauze, I want it to cover the entire wound where his foot is going to be rubbing against that. So as you do that, you want to tighten the sides of it, press down on it, but don't touch the middle, obviously, where the wound is, because that would cause your patient to have some extreme pain. Now I have to determine what type of wrap I want to use. I had gauze, but I also had the adherent dressing. And so I thought this would be best because it doesn't move around like gauze can move around. If he was just sitting at home and leaving it up, I would go ahead and do that. This patient should elevate his legs. There wasn't any inflammation or infection noted during my assessment. So I'm going to put this one on lightly. When I washed it the first time, I put it on tight because I wanted a pressure dressing because it was bleeding pretty bad when it first happened. So I'm just going to wrap this on, a little bit more than, it's not loose, okay, but it's not tight either. And these rip easily with your hands as well. I just go ahead and use my scissors when I'm going to do it. And then after I apply that final piece on there, I want to make sure that I kind of, press it down a little bit so it does stick, so it stays there. I love these wraps. I think that they do very well for these types of lacerations. All right, so now I'm just going to go ahead and pick up all my supplies and throw them in the trash with my gloves on. And I'll put back all of my supplies over here after I clean them. For my nursing note, I want to make sure I put my past medical history. He didn't have any. It was a laceration to the bridge of the right foot, and what I did to the wound. So I removed the current dressing. I cleansed it with wound cleanser. I applied liquid bandage and steri strips for closure, applied gauze and foam dressing, and wrapped with self-adherent wrap. No signs or symptoms of infection noted. Edges are well approximated. Mild sanguineous exudate during cleaning the wound. No inflammation, and after treatment, wet wound edges stayed well approximated.